The International Conference on AIDS and Sexually Transmitted Infections in Africa, which got underway in Durban yesterday, is discussing, amongst other issues, the impact of COVID-19 on the HIV-AIDS response, and to share lessons from the African countries on overcoming the barriers for testing and treatment. There are about 8 million people living with HIV in South Africa. And according to the Centre for AIDS Programme of Research in South Africa, young women in sub-Saharan Africa continue to bear the brunt of the HIV-AIDS. And for more on this conference, we're now joined by Sibongile Nkosi, who's the Executive Director, Global Network of People Living with HIV. Thank you so much indeed for joining us. Welcome to the programme.
Thank you. Thank you. Good evening, and thank you very much for the invite.
Often when we have these discussions, it's always at a very high sort of policy level, and leaders in the institutions have a voice. And I'd like us just to bring it down to the grassroots if we can. And I just wonder, as we hear all these statistics and all these things being mentioned, what is it like living with HIV in 2021? The drugs are better, but is access to health and all of these things that go with it there?
It's such an interesting question, because living with HIV in 2021 looks like a different picture, because what it looks like now, I mean, if you look at the infection rates, they're quite high. They're over 62% amongst key populations, which is the sex workers, transgender people, men who have sex with men, and young women. And therefore, the HIV response is looking at how do we respond to that? How do we, as communities on the ground, join with and looking at HIV from a holistic approach, looking at how do we actually build more solidarities with the sex worker movements, with also transgender movements, but also men who have sex with men, and also drug users, which I actually forgot to mention earlier on. So therefore, I think when you look at the HIV response now, one of the things that happened this year was the new political declaration from a global level. There was a new leaders from the global, from all over the world, made new commitments, which include the 95-95-95, which says that they wish to actually test over 95% and ensure that 95% of people are on treatment, and also the viral load is suppressed. But also, we also saw the UNAIDS new strategies, which calls for that we cannot end AIDS by 2030 without ending inequalities. So for 2021, really, HIV is looking at the structural barriers that ensures that, okay, so from a structural barrier, what are some of the issues that are still societal, like are still not enabling for people to access treatment? You know, when we look at the punitive laws, we're looking at how are people not coming to the clinic. So currently we're looking at actually the structural barriers, and communities are actually at the center of the HIV response.
All right. You know what? And I'm going to unpack that a little bit more, but I just want to get a sense of daily life in South Africa, for example. Someone recently diagnosed with HIV. Is there enough help? Is there enough medication now, so that it literally is just a question of living with an infection, but not something that, you know, before we used to be so scared and almost sometimes feel helpless because you just didn't know where to get help. What's this situation like now?
So when you look at, I mean, stigma still prevails, really. When HIV, when you look at it, in terms of like access to treatment, we've made really, really good progress, you know. but it's just the structural issues. So if you test HIV positive now, you are guaranteed that when you go to the facility, for instance, you can get an HIV test. For instance, you can then the policies actually state that you can choose to actually opt. So the new regulations basically say we test and treat, so people can actually get access to treatment immediately. But however, we saw with the lockdowns, the civil society on the grounds were monitoring the stockouts. We saw stockouts. People were not able then to get their viral load, because when you're HIV positive, we have to make sure every 6 months or after 1 year, you have to get a viral load testing. So again, just to highlight earlier on that currently right now, as people living with HIV, what we are facing when we're trying to access care is actually the structural barriers. And that's exactly what we need to fix. So yes, in terms of like the biomedical interventions, we're really, really far ahead. And there are policies in countries, even in South Africa, that says you should be able to get your treatment. But on the ground, it actually looks different. There's still stigma in the facilities, there still isn't enough in terms of like counseling, because, we can't deny that the 90s left us with so much fear in terms of the virus. When you look at COVID, people are able to test and still say, I tested positive for COVID, but for HIV, it's still a struggle because of the stigma that we were left with, and the residue of the fear of the 90s. So I would say that in terms of like policies, in terms of like access to treatment, it's on policies, it's there, but when people go on facilities, it looks very different. And therefore, it's so important that we continue actually to monitor it. Yeah.
Why do you think that we still have a stigma issue? This virus has been with us for decades now, and we really should have gotten past this. What do you think is holding us back and that needs to be addressed to try and get it right?
So firstly, I think we can't deny that the world, over 50% of countries all over the world are still criminalizing HIV, right? And as I said earlier on, currently HIV is high amongst key populations. And we still are criminalizing the key populations, even in South Africa. And therefore, it takes them away from facilities. And we understand that when people are staying away from facilities and people then are unable to actually live openly with HIV. And even in a country like South Africa, where it's still very hard to come out and say you're HIV positive, because even in our laws, there's still like the residue of like discriminatory, and which we still need to really, really work on. And therefore, it becomes very hard when the environment is not supporting. And if you look at in 2021, HIV messaging has really, really dropped. You find a lot of messaging. I think our government has invested so much in like misinformation around COVID-19, but we didn't see that in terms of sustainability when it comes to HIV positive, in terms of HIV messaging. Currently, one of the key message that the WHO preaches is the U equals U, which is undetectable, therefore untransmittable, which is a really, really key message to ensure that we reduce stigma. Because when people understand that when your viral load is undetectable, when you've been living with HIV, therefore you are not transmitting it to anyone. Therefore, then it reduces the stigma, and this has been shown in other countries, but in South Africa, we still have not reached yet. But also, the global targets are also showing that if countries reach the 1990 targets, which I mentioned earlier on, then it does also reduce stigma. But we as South Africa are also still behind in terms of that. So therefore, we have not yet actually fully changed the environment. But also, more than anything, I think it's the public education. We don't see that has quite reduced so much. We are also seeing a lack of condoms preventative measures in facilities. There's more sanitizers than preventative mechanisms for HIV, and yet in this country there are high infection rates in terms of like HIV. So there's still quite a lack in terms of that from even our policymakers. So yeah.
Talking about policymakers, we began this conversation and you were talking about these barriers that you need to address and that as communities you're trying to address. Who's putting them up? You know, we have the Deputy President this week saying that, you know, our health systems need to be bolstered up. And he is one of the top policymakers. Who is putting up these barriers for people living with HIV?
So firstly, I mean, the governments themselves go into like the global stage where for instance, the political declaration, they set in the UN and they agreed to meet the global targets of actually ending AIDS by 2030, right? And even the UNAIDS, the governments, the UNAIDS global strategy, it's the government who participated, who agree on meeting these global targets. But then the barrier becomes when they have to invest in that. And therefore, that's what we are seeing from a community perspective, that the barriers is within our own governments and that they are not investing. I mean, there's a percentage, which is about 11%, of the budget has to go to like HIV programming, but we're seeing a reduction in that even in South Africa. So the barrier is coming from the political will, from our own governments, and therefore, I mean, communities currently, which is civil society, have to then carry that brunt, you know, have to do some of the interventions that I was talking about, which is going on the ground and tracking people and ensuring that people stay on treatment. And so therefore, our governments are really, really letting us down because they are not putting the commitments that they make on a global scale into action when it comes to their countries. So I would say, you know, and for us from a global network perspective, we are really, really trying to advocate so that when they make the global commitments, how do we ensure that on the ground we see it? And I think in terms of governments, they need to understand that they can't really respond to HIV without working with people living with HIV on the ground, because we know right from the 90s that the communities themselves have actually organized, you know, to ensure that people living with HIV have access to quality healthcare. So the barriers is in government because the resources are there. The communities are ready to be their allies in HIV response, and they're just not using those resources and those mechanisms.
All right, perhaps as a final question, and one of concern for me is, whilst we're seeing the new infection rates decreasing over time, one gets a sense that, you know, we're winning the battle. But then you hear this little caveat that younger women are getting infected at a disproportionately higher level. Why is that? And what can we do at community level to reverse this?
So again, when you look at it's again the structural barriers, right? Young women, the access to health services. For instance, our clinics, our health services are not open for young women to come in and access preventative measures, right? So it becomes very difficult for young women to actually access health services. But secondly, you know, the global AIDS strategy highlights some of the economical barriers, right? And I'm just going to quote the UNAIDS director, Winnie, who actually emphasizes that, you know, one of it is around education. So young girls find themselves, first of all, not being able to negotiate. You know, so patriarchy also has a big impact where young women are unable to negotiate condom usage, right? Secondly is the economic status where young women find themselves then living in poverty and then have to get themselves actually not even, I will not say get themselves, it's actually the older men sexually abusing young women. for economic gains, so that young women can have a place, can eat something. So again, it also has to do with the social and also the political, but also the economic status of where these young women. So poverty plays a bigger role in that. And until we also deal with the inequalities that these young girls find themselves with in terms of like education and poverty, then we'll not be able to deal with the HIV issue, and we'll still see higher infection rates. So, and that's why the global AIDS strategy is so important, because it says it's one of the best strategies that we have in terms of HIV, because it says we need to ensure that we deal with the inequalities of where these young women find themselves in until we can actually deal with AIDS by 2030. So I would say, again, just going back to the structural barriers that the young women find themselves in, that then they are at higher risk of getting infected by HIV. So I think for policymakers to actually think, how do we look at HIV away, not only from a scientific point of view, but also from a political and economic and the structural barriers. So, yeah.
Sibongile Nkosi, thank you so much indeed for joining us. Great talking to you. Thank you so much for sharing this valuable insights with us tonight. Thank you.